I don't know. This might be good. So go ahead. Go ahead.
My thought was, we know that first contact in Star Wars occurred in Bozeman, Montana,
Star
right?
Trek.
In Star
Yeah.
Trek. Or what did I
Yeah.
say?
I knew you said Star Wars. I knew what you meant.
Oh dear, that's a bad faux pas. But, the whole idea was like humanity had to develop warp technology, right? Is that correct?
Yes, that is correct. Yep.
Before they would contact. And then the Vulcans, when we developed that, came to Earth and said, like,
Yep.
we're here now. You're one of
Yeah.
us, right?
They saw our warp signature and said, hey, we can go over there. Yeah.
But what if, instead of that being the cause of first contact, what if it's our AI becoming sentient and evil?
And our AI
And
goes, hey, could you come here and help me out? Because I've got this like really bad infestation.
Infestation of dumb
meat
life
sacks.
bags, meat sacks.
It
could happen.
What did Sandra think about that?
I think he kind of rolled his eyes. So I think that means, there was
It's
some
good.
validity to it.
Yeah, that means it's totally true and about to happen because he knows things.
Right.
He's like,
he knows
like,
things.
oh my God, the roll of the eye means like, oh my God, they're on to us.
Yeah. What if we're both living with aliens? We just don't know it.
That would explain
and they're using
some
our
things,
podcast.
Wouldn't it?
Yeah. To reach 35,000 35,000 people a year.
Crazy.
Yeah.
Okay. Well, that was fun. Let's start the show.
Let's do that. Mike, we have been working for almost 2 years to record an AI episode.
I'm aware.
And it's been pretty much smooth sailing, right?
Like so smooth. Smooth as a Minnesota country road in the spring.
This story, this pre-roll today is truly pure irony because we have reached out to radiologists who are experts in AI. No responses. AI medical experts, medical futurists. For whatever reason, we've never experienced this before with an episode where we're actively looking for people to join us and no one will even answer our emails or phone calls.
They just don't not getting back. People must be really busy.
Or they don't want to talk AI. We even had a guest scheduled who scheduled the time to join us. And when he joined, he said, hi, guys, I'm not ready. And we had our cocktails. Yeah. So ironically, is this irony that who helped us get this episode off the ground?
Chat GPT.
It did. We literally wrote the notes that we're going to share today from Chat GPT. Our drink was formulated by Chat GPT.
Yeah.
And it's good.
It's good.
And we basically asked artificial intelligence to data mine and give us the answers that we didn't know. So today's episode sponsored by ChatGPT, I guess.
I guess.
Indirectly.
Indirectly. They didn't mean to. Sorry, ChatGPT, for everything we say that's horrible. Welcome to the Vets Unleashed,
where we gather animal professionals and animal enthusiasts to discuss the most pressing, silly, and interesting topics in the animal kingdom. I'm Dr. Scott.
And I'm Dr. Mike. And let's just start with a drink.
Yeah, let's not do what we usually do and like 20 minutes in. Oh, we've been drinking this. So this is called the neural nectar. There we go.
Nectar.
Well, this is a herbaceous and floral gin.
Yeah.
2 ounces of that, an ounce of curacao, a lemon juice.
Yep.
And elderflower liqueur, an ounce of elderflower liqueur, or half an ounce of elderflower liqueur, an ounce of lemon juice, and then I like mine with a tiny bit of sugar just to balance it out.
I did not put any sugar in mine, but let's toast. Let's toast to our overlords.
Yes, to the AI overlords that created this wonderful drink for us that looks like a Romulan ale. Speaking of Star Trek,
kind of. Oh, that's pretty good.
It is. Do you know what I've discovered since?
It's very nice.
It's really nice. The orange just is delightful. But what I found is elderflower liqueur
Mm-hmm.
That just adds a classiness and a deliciousness to any cocktail. Like these
really
days, I'm like,
does.
I love one of those, but I'm going to add a little elderflower liqueur in. It's my new favorite cocktail ingredient.
I think we should just have a season where it's all Saint Germain. Completely.
I like that.
Yeah. But Scott,
Season 8.
Yeah, exactly.
Saint Germain season.
That's right. But like what I loved about this was when we put it in, we said, hey, give us a cocktail about veterinary medicine and artificial intelligence, or medicine and artificial.
Or medicine and AI.
Yeah. And it put introducing the neural nectar. And then it says like the ingredients, but it has like little things it puts with it. So it said 2 ounces of botanical infused gin representing the precision of AI. And the blue curacao was symbolizing the digital aspect of medicine. Elderflower liqueur for a touch of elegance. And lemon juice adding a zing of vitality. And then just putting things like that. And at the end it says celebrating the harmonious blend of technology and healthcare in a single delightful concoction. Cheers to the future of AI in medicine.
And then I wrote, this seems like there's no sweetness to balance it out. And they wrote, you're right. Curacao isn't sweet. And, you may benefit from a small amount of simple syrup.
Yeah.
Like, thank you.
Yeah.
And it is, I don't know which I like better. I like this,
Yeah.
It's the morning and we're drinking a cocktail. So I feel like, the sugar's just too much to break a fast, but just a little alcohol
too much.
Probably.
Well, that's the thing. I took a sip and I had my coffee, but I haven't had my breakfast yet. Mistake number 1. Because I felt that going all the way down and such a warm feeling inside. And you know what? Computers can't feel that.
Well, to tell you for our listeners, this may be a drink to make, because this and the other one was the Time Flies from an episode a couple weeks ago.
Mm-hmm.
Yeah.
Mm-hmm.
They're good. They are some blue curacao delights, I have to say.
Yep. Absolutely.
Uh-huh. Yeah.
I'm gonna take another sip.
And if you notice, if you're watching the video of this, we keep taking sips of this. So, this one's a worthwhile endeavor.
Yeah, that's a keeper. That's a keeper, everybody.
Mm-hmm.
Well, the other thing,
GPT. Yeah,
I know. So the other thing is, this is like a good time to start talking about this, because I started using something that you turned me on to, which is an AI-powered medical dictation app called Scribblevet. I've been using it for just 1 week so far. And it's kind of scary how good it is. So essentially, just if you don't know about this, and this is interesting.
And there are others aside from Scribblevet, but that's just the one that when I looked into them, that seemed like the one that Dr. Mike would most enjoy. And so I try and funnel new technologies to him since I'm not currently in full-time practice.
Yeah. So I'm doing a 2-week trial with it. And clients are very interested in it. Everybody else is but basically I have my phone, I have the app, and it just starts recording. I get permission from the people to record. Everybody has said, yeah, that's really interesting. And it just listens to our conversation. And if anybody out there has ever been in an exam room with me or any room with me, I like chat. Like I'm just like, oh, and let me tell you a story about the time I had my, so there's a lot to filter out.
Does it add in like, like a narrative, like Dr. Mike tells cheesy joke, client doesn't laugh?
I've been wondering, like last night there were some where we would be like super ironic about like, and then the leg fell off. Ha ha ha. The client and I were joking about something like that, right?
Right.
As a side effect of medicine. It didn't pick it up. I mean, it didn't put that in there. Like it recognized that that was not relevant.
Legs usually don't fall off.
Don't fall off as a side effect.
Probably err on the side of.
Yeah, it's not something that commonly happens as a side effect of medication.
No.
No. But I would say it's probably 98% accurate in getting things down. Every once in a while there'll be something that, like, if I'm doing and this is a really interesting thing too, like I'll be on the phone with somebody and I'll start recording it and it'll just hear my side of the recording and it'll still intuit basically what we're talking about. just as you might, if you were listening to somebody talk on the phone, you'd be like, oh, they're talking about a dog that's limping and they're going to use, some NSAIDs and, Librela or some other, or Adequan or something to help with it. And it puts all that in there as as a client callback and just puts it in. And then it also generates an email for me to send to the owner. So right now I'm still going through and I'm making corrections. And the other thing that happens is if I make a correction and like, oh no, it was Proin that was the drug I was using there. Now it's trying to put Proin in all the time. It's like, oh yeah, and it wanted, so it's overcompensating a little bit.
Right.
But
I've heard that it learns. So we have a classmate up in Portland who's been using it for several months now. And he said he's been able to get rid of his in-room assistants. He usually, and I worked at one of his practices where every time we went into a room, we had a assistant that helped us take the notes, write down the temperature, the heart rate, and all those things. And this does it for you, right? I mean, essentially you bring in some type of device, you start the recording. It's not truly recording. It's just listening and dictating from what it hears. And then it puts it all together. It also creates a differential list, correct?
It does, but that's usually, it seems like that is based on things that I've said, the differential list.
Okay, it listens to you and adds those in. Here's the things we would be most concerned about. And it lists those higher in the differential list then?
Right, exactly right. Yeah. So it does put the differential list together. It puts everything. The right now, I would say there's a lot of noise in it, meaning it takes down so much information that it's hard to, suss out those pertinent things if somebody else were reading my exam. So it's a little bit too much right now, but I think that it's just a matter of tweaking it and having it,
But how many times as veterinarians do we have a medical record that perhaps we've entered in all the things that are legally relevant to sort of protect us, and we put in the things we need based on our bias and how we know that we read our own records? But, you've said it's more complete and more thorough than your medical records typically are.
Absolutely. And that I really do like it. I just need to work on formatting, but it remembers things. Like there are times I will offhand talk about, leash reactivity, and it's not the main reason they're there, but I'll give them a quick tip on it and mention it and maybe mention a supplement they could use or something. And if that's not better, give me a call back. I would not have remembered to put that in the medical record because it was there for limping, or coughing.
And that might be the one thing that the client was most impressed by. Like I went home and, and that really worked. And then they show up to you and they're like, last time I was in, you gave me some behavioral advice. And you're like looking through the record. And
I did.
What was it? And now you could say, oh, the leash reactivity. Yes.
I'm so smart.
Well, hey, we should probably back up a little bit. Let's take a step back first and talk a little bit about what is AI. And then we can finish off by talking about all the ways, not just what you're doing with ScribbleVet, but all the ways that AI is being involved in vet med.
So what is AI? Like, how is it different from just like so just a dictation thing, right? Like it's just writing things down. How is it different from a program that just listens and pulls things out?
Boy, can I answer this. I actually, I wanted to learn. I mean, this is truly something you're seeing, and it just seems like it has the breadth and the power to sort of take over and improve so many processes that we, not just medicine, but across humanity. It's pretty amazing. And it seems to have just like recently really exploded, even though the concept of it has been here for years. So I took a Coursera course from the Wharton School of Business because we couldn't find any experts. So I'll become one. Yeah. And as with most academic endeavors, I would say that, the more you know, the less you understand. I'm probably more confused now than ever. I'm just at that point in my understanding. But, to back it up, because we have a lot of scientists that listen to this show. So they, our listeners, I think most of our listeners understand the scientific method. So how does the scientific method work, right, Mike? Like
Mhm.
if you're going to do a study, what do you start with?
You start with a proposition or some question you want to answer.
A
Yeah,
hypothesis.
a
Yes, a
hypothesis.
hypothesis.
I was dumbing it down, so I didn't. Like you have a question or a hypothesis, something you think
yeah,
is true, something you're setting out
not
there.
just
Yeah,
a question, but you have an idea of how it
yeah,
relates, and then you
yeah,
design a study to figure that out.
yeah.
So originally, what I heard and what I learned is that with that, every study that's been done in medicine and science, and probably any scientific endeavor in the world, there are certain things that cloud the ultimate outcome. First of all, we have our own biases. And those biases might influence the very hypothesis that we're studying, right? So we may study and even prove there's a correlation, and we think it's
causal.
It's causal, right? And then, but with AI, it throws you into this world where you wonder: is causation or correlation, does it even matter? Because if it's correlated, and there's 6 other steps or 8 other steps that a biased human mind would never reach, but a computer can see that connection, does it matter what those steps are in between if it's truly connected consistently and statistically? But anyway, the idea was, and the course that I took was a lot of, how does AI mine the data? How does it deal with data in a way? Because the other thing people do is we all make mistakes. So we're biased and we make mistakes. And those are 2 things that computers don't struggle with, right?
Right. Unless we plan that into them.
Exactly. Well, that's how we'll end it. Back to our Star Wars discussion about sentience. But well, the idea is that we may not see that there's different ways that artificial intelligence or computer system can mine data and pull data in packets, looking for correlation that we may never see. And you can look at it in pockets of data. You can look at the whole thing. You can look at subsets of data. But the reality is, it's very good at recognizing patterns and seeing correlation where we may never see it with our current statistical methods. But then, so I'm like, okay, I can grasp this. And then there's the component of learning, which is a lot of these programs have a built-in element where, as they mine things, they learn, okay, with this type of data, I'm better off using clusters of data to look for patterns. And so the computers learn and they get better with time at analyzing the data, whether that's medical information or radiology or lab results, all of that stuff. But then, I just feel like I'm kind of getting this. Like I see what AI is and how it works. And then I read an article this morning that talked about hypothesis generation. And typically, even the most brilliant minds in any field, and I think here, do you know Dwight Bowman, parasitologist from Cornell?
From Cornell.
Okay.
Yeah.
Absolutely
brilliant.
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 Kooky, brilliant PhD.
Love him. Yeah.
Parasitologist who was at the human med school, but now works with parasites in the veterinary school. But he's every time he thinks of a new hypothesis or a new idea, or wonders if there's a question he needs to answer, he's the kind of scientist that will run a little study to figure it out. And I'm told he has stacks of data that's never been published. He's almost like a human, as close to AI as a person can be. Right. So he's got all these hypotheses, and then he runs a little study and kind of finds his answer and moves on to the next thing. Well, now they're using AI to generate hypotheses. So they're saying, here is the bulk of the published data that's out there. Where should we go with our studies? Like, what have we learned? What questions haven't been answered? Is there, they're starting to take these clustering of data from the studies, almost like a super meta-analysis, to figure out where do we go next. And that's when it starts to become like, mind-blowing, where it's like I don't think most people could do this.
Yeah. Well, we can't, because we don't have the computing power. And it sounds like, I haven't taken that course, so you absolutely correct me if I'm wrong, but human brains are really good at making, like seeing patterns and making connections, right? That's what our brains are designed to do because it helps us stay alive. Oh, that thing was dangerous before. So, right. And so, and we do it like so many times, every day without even thinking about it. It's not a conscious thing. Our brains just do it. But we also are really influenced by emotion, by previous things that we've learned. And so hopefully it sounds like that AI will take some of that out of there, take some of that bias out of there. Is that the idea? Or am I way off?
And also, our pattern recognition is much simpler, I would say.
Okay,
even
fair.
the greats, the academic and intellectual greats of our society,
Dwight Bowman's,
yeah,
Scott
the Dwight Bowmans
Weinman's,
of the world, the
Albert
Mike
Einstein's.
McClenahans, they're coming nowhere near to the depth and complexity
Yeah.
of the patterns that these AI are already recognizing. So, I mean, that makes it a very humbling thing, because then, and where we need to go after, after our break and the second half is, what are the pros and cons of using this for medicine? Obviously, the reason it's exploding is there is a ton of opportunity to improve outcomes for, patients in medicine, to create new hypotheses that might lead to, the next big thing in science, the cures for cancer. I think all those things are very close, and I think that AI will play a role in the next big scientific discoveries. So, but what do we need to be aware of? How do we use it appropriately? Are we ready? Are we not ready? I mean, that, to me, that's where the second half of this discussion has to go.
All right, we'll be right back. Hi, this is Dr. Mike, the Bowtie Vet Guy. Thanks for tuning in to The Vets Unleashed. If you want to find out more about us or our guests, or to leave an amazing review, head on over to thevetsunleashed.com or find us on Instagram or Facebook at The Vets Unleashed. There you'll find information on the podcast, how to be a guest, and our lecture series and speaking availability. Now let's get back to the show. And we are back talking about artificial intelligence in veterinary medicine, and having a drink that is concocted by artificial intelligence. We talked a little bit, I talked about my experiences using a new AI program in veterinary medicine. But other places, I mean, the thing I'm most familiar with would be radiology. Seems like that's probably one of the first places that artificial intelligence is being used to actually read X-rays, right? I mean, it's looking at them
and I've also
and
seen
giving
it,
a diagnosis.
The two areas that I've seen it most commonly are in radiologic interpretation, so interpreting X-rays, and pathology and cytology,
right?
Where they're using models, and then from what I understand, the pathologists look at the slides to confirm the AI diagnosis. And a lot of the new companies, Zomedica, Zoetis, a lot of the veterinary companies now have these systems where you can upload your cytology. So cytology is pulling a few cells, like say your animal has a mass that wasn't there before, right? Dr. Mike would put a needle in there and do what's called a needle aspirate, and then spray those cells. And some of these computers even actually create the slide for you, stain it, upload the image, and then my understanding is the ones that use AI, the AI looks at those cells and comes up with the diagnosis, and then the pathologists just confirm it. And I assume it's similar with the radiologists, correct?
Yeah, that's what I assume as well. So the lecture I went to, one of the interesting things was they looked at not just how it's used, but like also if AI got it wrong, how likely is a radiologist to agree with that wrong diagnosis?
Right.
So the specialist, not as likely to agree with a wrong diagnosis, but general practitioners, very likely to agree with an incorrect diagnosis. So
Well, and
one of the
I've
things
been
to
in
look
that
at.
situation even with radiologists. I'm sure you have as well, where
Yes.
I still have a case that haunts me. It was just this wonderful German Shepherd, really sweet dog that was boarding. Both his parents, or at least his dad, was an MD,
Hmm.
I think an ER doctor in the Portland area. And we took x-rays, and
Hmm.
we always sent our x-rays to a radiologist for review. So there's no AI here, right?
Right.
But I swore I saw a corn cob in that, and
Yeah.
I've been an ER vet long enough to know what a corn cob looks like. I actually called the radiologist and said, this dog looks like a
Yeah.
classic, it looks like a mechanical ileus. And I think it's a corn cob. And she talked to me and she said, here's all the reasons why this isn't a mechanical ileus, right?
Hmm.
And
Hmm.
so, despite my gut feeling, I have a specialist telling me, don't worry. So I send it home with the boarding kennel facility saying, I gave it some fluids just in case there was anything there to help move it
Yeah.
through. And I sent it home and I said, if we're not better by, within 24 hours, I want to retake an x-ray. I was even thinking barium, which I haven't done in years, but I'm like,
Oh my
I'll do
gosh.
barium
Yeah.
because I don't believe. Sent the dog home. Unfortunately, the kennel operator thought the dog was okay. He wasn't any worse, that kind of thing, until it was very bad. And then he ended up going to, a critical care and a surgeon to have a corn cob removed. Right. So, like, at least in that situation, although it bothers me to this day, I don't think she was malicious, even though she was wrong and I was right. You're going to always err on the side of listening to the specialists. Are we there with AI?
Yeah. And it's a valid question to start thinking about and to ask ourselves every time, as veterinarians, every time we get a diagnosis that doesn't quite sit exactly with what we were seeing, right? Um, but on the other hand, too, maybe AI can help with that, right? Because just as we were talking about with my, it's taking down better notes than I do. Maybe now AI has more information to get a better diagnosis.
And that might be the piece when they run it through their, when they figure everything out, that's the one piece that swings it into the.
Yeah, go to surgery.
They say in medicine, when you hear hoof prints, think horses, not zebras, right?
Right.
But every once in a while in medicine, a zebra runs by.
Yeah.
And you got to be ready for those. And it's maybe AI would pick up those things and elevate our diagnosis.
Right.
If I think about editing what an AI computer program spits out for me as the possible diagnoses, I'm going to use my 25, 30 years of experience to change that, move things around, if it's not right. I mean, my understanding is that it learns from us. And so that AI program you're using, as do the others, is learning, like, in this situation, Dr. Mike made intestinal lymphoma higher on the list than,
IBD.
small intestinal bacterial overgrowth. And so
Sure.
here's, they learn.
Hmm. Yeah, they do. Well, and that's a great question for veterinarians to ask is how is it
Mm-hmm.
learning and what is it using to make those decisions? So, for
Yeah.
instance, when we use our in-house blood analyzing machine and I get a CBC back, if that CBC is wildly wrong, it says the hematocrit is 12 when it should be 30. And I'm like, nah, if it were 12, I would know. The
Yeah,
gums
I
would be
would.
pale, like that, right?
Right. It doesn't
So
match with the case I'm
exactly,
seeing.
exactly. So there is a way for me to look at that. They have that scattergram, at least for IDEX. They have that that graph of where everything, all those different
Gives
things
me
are.
nightmares. But yes,
Yeah,
I'm
nobody
familiar
looks
with
at
the
them.
scatter graph.
I look at it when something's really, really wrong, right? And I'm like, oh, God, how
Right.
does this work again? What is this thing? And I go to the computer and I look it up. But that's a way for me to be able to check it. With AI, I don't have that ability to check how AI is coming
And
up with the
on
answer.
one hand, AI may be programmed in a way that they learn from those things just like a veterinarian does.
Mm-hmm.
But on the other hand, AI may just look at that as a data endpoint and spit out something that's entirely incorrect because it doesn't have common sense.
Well, it doesn't have the years of, it doesn't have all the input that we do, right? So we're, things we might not think of. Smelling, exactly what I was thinking of. It doesn't smell, it doesn't see. All it does is it hears what I say, right? And so, it doesn't have complete input. Oh, when is AI going to get a smell-o-vision?
Yeah.
I don't know.
It's probably coming.
I'm sure it is. Anyway.
Yeah.
So as veterinarians, there's lots of ways I think we can use artificial intelligence, and I think it's coming whether we want it to or not. It's already here. And it's just a matter of recognizing how it's helping and how it might not be helping, and being very aware of those things. What do you think for pet parents? What did they need to be aware of?
What's interesting to me is that I've even seen some like radiology companies advertising no AI, only human radiologists.
Right.
So, I think for pet parents, they're going to learn, like, first of all, I think it's incredibly valuable that your clients are coming in now and saying, oh, Dr. Mike is playing around with an AI tool and he asked me for permission to record, even if you say we don't keep the recording. I think just to know and full transparency, like everything else in vet med, if you make a medical error, if AI makes a medical error, if something changes, even if it's unpleasant, it's our job to have honest conversations with our clients. So I think, it doesn't change the relationship to you in any way. Mm-hmm. The way I would look at it as a client, if I came to you and you were using AI, I would think, I already love Dr. Mike. He's a great vet, one of the best in the greater Studio City area.
South,
for GPs, all the MASH people are listening going, he's not better than me.
They're Hollywood. It's fine.
Yeah, exactly. But I think it's a tool like anything else. And if I would still want to know as a client that you're in the driver's seat, right? And if GPs are more likely to, agree with a radiology AI report than a radiologist might be, then I think we reach out to our specialists just like we do now. AI is telling me this. I don't quite believe it. My gut doesn't feel right, or it doesn't fit with the patient I'm seeing. But in the end, just like the Mayo Clinic, where they have all these teams, it's not just Dr. Mike. You may be the quarterback, right? But you've got this whole team behind you. I think AI is just another tool that falls in line to help you get the best outcomes for your patients.
It should add to our humanity, not detract from it.
That's beautiful, Mike.
Beautiful.
I'm going to stitch that into a sampler and send it to you to put over your toilet.
All right, I have a little bit left here, so let's toast to our AI overlords.
Cheers.
Cheers. Thanks for joining us for drinks and a conversation about veterinary medicine and our beloved animals. The Vets Unleashed podcast is wholly owned by the Vets Unleashed LLC with excellent production by Earweevil Audio. For more information about us, head over to thevetsunleashed.com. And as always, don't take advice from people who've been drinking